Hello, welcome back to YouTube channel for Coverage by Cassie. I, Cassie Caton, am your health insurance advisor when it comes to all things health insurance. Now, right now we're covering a series of 10 things you need to ask before choosing your health insurance plan. We've already done parts 1 and 2. This is part 3 of 10, where number 3 is when asking, will I be able to use my current doctors in my plan? Now, when it comes to your doctors, there's a couple routes it could go. If you're in that PPO network, which we've discussed in prior videos, those policies give you in and out of network benefits, meaning even if you find yourself with a doctor that you really like and really want to keep, you'll still have benefits paying for you. You just won't get that network rate. Now, say you find yourself in an HMO. Those are going to be different, where if you find yourself out of network, you're not going to have coverage unless it's emergency care, typically is what I've seen. So when it comes to being able to choose your doctors, PPO, you have a lot more leeway. You're able to have better selection. They take a lot more doctors. It is nationwide. Once you get down to HMOs, it's a little more selective. If you really find yourself just loving a doctor, some people just end up paying cash out of pocket because it's worth them to save maybe monthly cost in your premium of what you pay for your health insurance, but it may be worth it to you to come out of pocket a little bit more for those individual doctor's visits if you're not going too often a year, or if doctor's visits are something that you see a lot of and you have specialists, it's probably a little more important to you to be sure that they are in network. The insurance is going to help with your costs of those visits. So knowing if your plan will allow you to access your current doctors is crucial. If you're ever just needing a list of what plans accept certain doctors, that's very easy to find on the specific sites, or if you have me as your agent, that's something I find and email to you. So it's much easier process, and you're not having to hunt and do all the Googling on your own, because I know exactly what to be looking for. So I hope that helped you understand a little bit more of the part number 3 of what plans and if they will accept your current doctors. Now, if you're somebody who just moved and don't have maybe a doctor in place, you can actually just get the list provided and call, see if they're accepting new patients, and go kind of reverse style that way. So there's really no wrong way to do it, just knowing how it works for you. So I'm excited to go over number 4, which will be what benefits are included. So that'll be a big part of something you need to know before choosing your policy, and then recapping part 1 and 2 of what plan is it, and then how much will you have to pay for medical care or your cost of coverage. So if you find this interesting and had a great time listening, hit the subscribe, hit the like button, and leave your comments below on other topics that you'd like me to discuss. So follow along with me. We'll be going through 10 questions of what to ask before selecting your health insurance plan. So we will talk soon.